We've spent over the last couple of years protecting the NHS, saving the NHS by not using the NHS. That was the whole point. They told us to stay at home, do not use the NHS so you could save the NHS, as opposed to the NHS saving us. The problem we had is that since then, the culture is changing. This machine, this untouchable machine, cannot be touched, essentially, because it's untouchable. We can't even talk about it. This guy is the council chair of the British Medical Association. Now, the BMA is essentially a left-wing trade union for the healthcare workers, and their influence does matter. These guys have come out to not only defend the doctors who refuse to treat patients in person, but they've gone further. So there's this massive row with some of the GPs who are refusing to see patients, even though we're still paying their salaries. They're still getting paid. The funding. Not only that, the government and the Prime Minister have announced a new extra £250 million for the GPs, the practices, so that we could help them. More money. Sure, of course, that's what we do. We increase taxes on ordinary people. We tell them not to use the NHS, and then doctors say, we don't want to see you. The problem here is that now the BMA have come out to say that people, by people, they mean patients and taxpayers, who are calling their GPs and asking them to see them. They are the bad ones. They are the bullies. Or they're abusive. Or they're essentially harassing the doctors. Oh, are you kidding me? This is the beauty, by the way, of the monster that we've created. For those of you who are familiar with the works of Ben Shapiro, he said this in one of the debates he had a few years ago on healthcare, and how in America, when he said, even in America apparently that was controversial, that healthcare is a commodity. It's not some sort of God-given right. In Europe and in Britain, people don't really get it. They're like, wait, what does that mean? No, it has to be a right. But in reality, of course, someone has to go to work, someone has to wake up, provide your service, and then get paid for it. They're not slaves. Doctors and nurses they're not supposed to be slaves. You can't force them. But the NHS as a system, a universal healthcare system, forces them to do it, and that's why there's a backlash. So I'm seeing both sides to this argument. The backlash of why BMA and GPs are kicking off is because for years we've treated them as essentially you have to do it. And that's why they're coming out to lash out. Now, what they're doing is wrong, absolutely wrong, because we're still paying their salaries and we want a basic treatment. It's not really rocket science. Now, this guy, the council chair, has come out to say that essentially, if the general practice was an employee, it would claim harassment, discrimination, and victimization. Well, I mean, what? What these guys are saying, they are unintentionally taking Ben Shapiro's side and my side, essentially. So you're now admitting that healthcare and providing healthcare as a service is a commodity. So you should not be forced to do it. So are you in favor of changing the model of the NHS? Thought not. Next example that we have is from Nottinghamshire, where some of the doctors and staff are complaining because patients who are in need of support are calling these practices in Nottinghamshire and demanding to be seen by the doctors. And now the staff have obviously contacted the Telegraph and saying that, we feel victimized because people are calling to demand to be seen by the doctors. What's happening here? Why is everyone such a snowflake? Make your mind. What do you exactly want to do? If you want to be against the government's orders, then go independent. More independent than the GPs are. Just go private and you could decide whatever you want to do. We have a system in this place. You pay. You take, the NHS is not free. We are paying for the service. If it was free, then I would get it. We have no right to demand anything. But considering we pay for the NHS, it's not a free system, then why are you surprised that patients are calling and are angry because they're in need to be seen by their doctors, and when the doctor says, no, I don't want to see them in person, of course they're going to shout at you. Stop being a snowflake and start providing the service. We protected you so that you can now protect us. Now, on the main website, the main channel, the daily, Monday to Friday podcast continue. Today, we have a special Westminster Roundup with Peter Barnes on it's David Amos and the consequences of what's been happening over the last couple of days. So if you want to support the channel and get more content, the premium content, then go to my2c.co.uk. The link is in the description. Or if you want to support this channel separately, then just click on the PayPal link in the description. And I'll see you guys on the other side.